Ryan Stanton here with ACEP Frontline, and today have another one of our COVID-19 public-facing podcasts, so one that's good for physicians and other healthcare professionals, but also for the public as well. Information to assist in the management and care, and really in this day and age when we're dealing with so much unfortunate information, false narratives, clickbait, just outright conspiracy-based theories. Just right actually before we talked, I was on another phone call and asking about clarification, because the internet's so full of so many things, some of it great and just some of it completely wrong. And so some emergency physicians got together and decided to put together information based on all of this information to help the public and others deal with COVID-19. And so coming back to an old friend from our days in PR and communications with American College of Emergency Physicians, Jose Terradas, who brought this up in front of us and said, hey, check this information. And we thought it'd be great to pass along for you guys too, because one of the most important things that we can provide is not only the care within our emergency departments, but also quality information that can help the public and others navigate the current pandemic situation around the country. So, Jose, thanks for joining us here on the podcast today.
Thank you so much for having me, Ryan. I feel like I only see you once a year at our annual assembly, so this is a special treat.
Yeah, you get to see summer Ryan. So I've got the summer hair, which is actually COVID hair. Just cut it as short as possible, not knowing when you may be able to get it cut again. So, and also for the heat related here in the South with humidities and temperatures, seeing who can race through 90s the fastest. But of course, I think you understand the heat related issues as well.
Oh, we're dealing with our own 90-90 day as well today. So it's going to be must be an indoor day.
So let's get an idea of what is this program? What are the resources that are available out there?
Sure. And I do appreciate you having me on to talk about it, because as you said, right, our goal is not just to help talk to patients when we see them when they're in the ER and we can have that face-to-face conversation, but there's so much that we wish that we could give them as resources as they walk out the door. And as we started to do our early research about where could we find ways to really help the public, this type of education seemed kind of where there was the biggest gap. And what it was is that we get a lot of focus on patients who are hospitalized and what are the latest treatments, remdesivir or convalescent plasma or hydroxychloroquine, or about the sickest patients. But what are we doing for those 80+% patients that are maybe never even stepping foot in a hospital and have to care for themselves at home? And that's who we're gearing this course for.
So we're looking at a very easy resource, not only that physicians and healthcare professionals can refer for their patients, but patients can seek out on their own, of course, free related information. Give us a background of really what is entailed in here and some of the recommendations that we have for patients, because I think that is really important. You hit the nail on the head. We focus so much information right now on the 5 to 20% that are going to end up in the hospital, with that number kind of pushing down as we get larger positive numbers, but still a small minority of the population that has the complications that require inpatient admission. But the majority of folks out there are going to be dealing with this at home. And I mean, I know a lot of people run that question of, do I need to go to the doctor? What's the steps? If I test positive, have mild symptoms or whatever, do I need to go to the hospital? Do I need to go to the ER? Do I need to, and then when to do those things? So kind of march us through the content that we have in there and that the resources that it provides for the patient and public.
Yeah. And when we discharge patients from the hospital, we like to give them some information or some guides, some tools. And, with everything that's changing with COVID, with the difficulty of not having visitors come into the ER to be with patients, the fact that our even face-to-face interactions with patients aren't as great because we are trying to minimize our own exposure with PPE, resource shortages, that it's good to sometimes just give folks a website. Listen, go here. This was created with the backing of, ACEP, the country's largest ER doctor, organization, with no other agenda other than, free, high acuity, so you're not going to be wasting too much of your time. Everything in there is worthwhile, and we just want everybody to get something from medical professionals.
So easy to digest and break down information. So let's walk through some of that information, review it for public here. And of course, we will make available the links and information that you need to reference later. But we've got time and an opportunity to listen right now. So let's walk through some of those recommendations that we have for the patients. And Jose, I'll let you just kind of march through however you see fit with this type of standpoint, COVID with the public.
So I think the first question that people will come across is, when it hits them closest to home, whether it's themselves or somebody who is at home. So I think the first question people get is, when I start to have symptoms that are suspicious for COVID, what do I do? Do I need to go to the hospital? Do I need to talk to my regular doctor? How can I get a test? And I think that's usually step one. And that's very location specific. It's very insurance specific. So we walk you through that. What do you do? So the first steps would usually be to reach out to your doctor and see what would be the easiest ways to get tested. And then we also provide a bit of a checklist of, here are things to look for that tell you just need to go right to a clinic or the hospital. Or if you don't have these symptoms, here is how we're going to kind of march you through or set up a plan of how we're going to manage your symptoms at home. So step one is, I think, what do you do when you first develop symptoms, and who do you talk to?
Interestingly, what I like to see with this is it's broken down almost like an easy to understand discharge summary, but with all of not only the information in the standard format, but also the videos. Looking at the first video, chapter 1, how to prepare for COVID-19 with Dr. Hank Taliaferro from the Duke City Urgent Care. And so preparing at home for COVID-19. And that's some important stuff, because I think there's so many questions. We see the stuff that's in the media about the symptoms and things like that, but how do you prepare at home? What happens in case a family member contracts COVID? We're actually dealing with that right now in some of motorsports. And when it's in a certain person or group of the family, how do you deal with it from across the board standpoint, tracking and recognizing some of the symptoms, especially this time of year where we're dealing with so many allergy-based issues, managing some of these key symptoms, including breathing exercises. And then I think really one of the most important questions that almost everybody has is, when do you need to go to the hospital? Because we don't want you to have to go to the hospital if you have rather mild symptoms that can be managed at home. But we also don't want you to sit around and wait too long. And then what we've seen with some of the complications is where you come in just knocking on the door of that tunnel and then, just hoping we can get everything done that needs to happen before there's a bad outcome. So, and it's broken down in individual chapters 1 through 6. In terms of learning to prepare, how to track it, how to manage it, when to go to the hospital. You got some frequently asked questions, and then the extras. And then, of course, especially with what you've done with all the wonderful work with the Communications Committee for ACEP, is making the resources available for the Spanish-speaking population as well.
However we can reach this highly diverse country of ours, the better off we can have our public prepared in terms of facing such a tremendous challenge as is COVID right now, the better off we will be as an overall population. And, when we talk about, initially when you were mentioning about how do we break up the initial series, a lot of it, when you first get a diagnosis or a suspicion for diagnosis at home, is we talk about preventing the spread amongst the community, but it really starts at the simplest, most microscopic level. It's at home, right? So if you have a house that is 5 or 6 people deep, and you don't have a lot of space to necessarily quarantine or isolate, or, this is how you get that spread from 1 to 6 that happens very quickly. And then that's how you get within the community. If we don't have good management tools at home, you can just see it spread, like wildfire, and then it can just, jump from place to place. So yeah, I think the keys are really, really important, and to give folks at home who are caring for their loved ones as well a bit of a framework of how can we really prevent this from turning into a much bigger issue at home, because that's really what happened in New York, Italy, Spain. I mean, these places are unique because they are multi-generational households that are very tightly packed. And so kids would come home without a lot of symptoms. Next thing you know, grandma's dead a week later.
You got some heavy hitters here. Not only yourself, you in a white coat on the videos. I mentioned Dr. Hank Taliaferro. You got Dr. Susan Wilcox from Harvard Medical School, Dr. Lee Vanoker, who's a long-time emergency physician with her own radio show and programs. And so, I mean, a very, very well, that's a combination of having the information with people who naturally have a great skill at communicating that information. And I think for most people, the presentation style is going to be very welcoming. Not only the videos that kind of explain everything, but also then the print version and then graphics that are available, such as a symptom tracking and going through all the things such as monitoring your oxygen saturation. If you actually listen to the podcast where we had the family physician that got COVID and ended up in the hospital intubated, his main thing that he monitored was his oxygen saturations and watching it and keeping track of it. And that's when he knew that it was time to go into the hospital, knowing the research, but then knowing based on these activities where those numbers are. And that's when you need to report to the hospital. And for most people, other than the hypercoagulable related issues, the clotting issues that seem to be an issue with COVID, it is basically, in many cases, the respiratory standpoint that really is going to drive folks in. But a lot of this information seems to be a great opportunity to jump into it now. So even if your family doesn't have COVID yet, if you don't have somebody close to you who has COVID yet, I mean, the real setup in this seems to be that preparation standpoint and getting ready and having the information prior. I mean, it's there if you've got it and you want to turn to it and kind of cram for the final exam at that point. But seems like a lot of it's set up in order to have you prepared for, as we move forward through 2020 and into 2021, how to address if this does enter your household. Is that correct?
Yeah, and it's also, this isn't something that happens quickly. It's, as you mentioned, it's going to take months. It may take years. And so this is just a resource that if you know some bits of information, you able to pass it along to a friend who's able to pass it along to another person. And as we're able to equip every single individual who at some point, at a first to a third degree, is going to know somebody who it gets affected by this inevitably at some point. I think it's good to be able to offer them information, and we wanted to present it visually so that you could hear it, so that you could read it, depending on what your styles are. We recognize that learning is a very unique experience for everybody. And one of the big things with the Learning Agency, who is the group that we collaborated with along with ACEP to put this together, is that they're all about teaching in a way that you've really learned something if you can then walk away and repeat or teach somebody else what you just learned. And they really study the science behind not taking a multiple choice test and just picking the right answer, but being able to go out and talk to yourself. And can you just teach yourself what you just learned? So this is how we try to present it.
Working through the websites right now. The one initially sent me to the COVID19athome.org with nothing in between. That actually redirects you to, you just mentioned the Learning Agency. So the learningagencylab.com that does the COVID-19 at home guide. We'll make sure that those links are available for everybody out there to be aware of and to be able to track those things at home. And the layout's very simple. It's one of those things that, if you see a lot of media-based sites and things like that, it's very complicated, very, a lot of times very difficult to find what you're looking for. But just the header across the top, how to prepare, how to track, how to manage, when to go to the hospital, frequently asked questions, extras, and then in Espanol right there, so you can kind of click along. What's your recommendation in terms of folks right now? We're seeing these numbers increase around the country. Many states, kind of hospitals busting at the seams in certain cities and in areas, and of course, record numbers in a lot of states, including Florida, Texas, Arizona. What's your recommendation? Like, even if this isn't at home, we kind of already hinted at it. We don't want you to just wait for everything to happen and then try to catch back up. What's the time commitment in order to kind of run through this, to kind of get yourself aware and prepared before it even comes within the walls of your household?
Because you're able to go checkpoint or chapter by chapter, you can pick and choose what areas you feel like you might be a little bit more deficient in terms of preparing yourself for it. I agree with you. There's no downside in looking at it. The sooner, the better. Comparing it to others, there's no clickbait. There are no ads. There is no having to scroll down, through a whole bunch of different things that you're just going to have to, continue to push next on to. No, there's none of that. It is just bare bones. Everything is high yield. On it. So I would think that to go through the entire point, even watching the videos, you're looking at about an hour. But if you really say, I know 2 or 3 of those chapters and I really just want to learn about how to prepare myself as a caregiver, or what are some breathing techniques that I can practice at home to get my breathing and oxygen levels higher, that could just be minutes.
So as Jose mentioned, you can pick and choose, but I definitely think at least, as heads of households, mothers, fathers, whoever it may be, they are going through there and, getting familiar with some of those basic things to look for. Because how do you tell the difference between COVID and just waking up with a dry, scratchy throat from potential allergies or things that we're dealing with right now, or whatever may be out in the environment, or what I see a lot of people coming in talking about. I went out and mowed the yard and came in and had a little bit of congestion and cough and sore throat, and really, of course, now everybody's a little bit on edge when it comes to COVID-19, especially in certain areas of the country. And the more that you're prepared, the more that you're ready, the better you're going to manage it once it comes through and kind of can flow through those situations, especially understanding the notification of your healthcare professional and going in and getting checked versus when to get checked versus how to monitor and what to monitor. And as you mentioned, the exercises and things like that are available. How can people find this? Of course, we'll put the website and everything on our show notes on the link of whatever the platform is that you're in, but just look in the description of the podcast, and we'll have the link in there if you want to follow along. We'll make that available online as well, but we want to have it in an audio version as well. So, Jose, how can folks find and follow the information on this page?
Last I checked, this is if you Google Learning Agency, the Learning Agency, and COVID-19 at home, as far as I know, that's the first thing that pops up, and this should redirect you directly to the class itself. I know there's essentially like a YouTube channel for a lot of the videos that are on there. So if you find yourself in a position where you just want to be more auditory than reading, then you can just put on the YouTube channel, and I believe through the Learning Agency, once you hit one of those clips and they're all on YouTube, it'll just direct you to the channel that is on there. When you were mentioning before, this is a preparation. When we talk about preparation for disaster, we're in the middle of a pandemic, so we're not preparing necessarily for something that could or potentially might happen. We should probably be focusing on it as this is an inevitability, whether it's in our home or potentially down the street. And so being able to do the right things at home can help keep more folks out of the hospital. More folks out of the hospital lets us care for those folks who have maybe done everything they could at home and have still needed to be hospitalized, because the scenes get ugly when we start to overwhelm the hospitals. There was a CNN interview the other day where they went to a hospital, I think in San Antonio. They were talking to an ICU doctor there. And he mentioned that in that day, he had gotten requests for 10 beds in the ICU, all for patients who needed ECMO. And he just said, very bluntly, he said, I only have 3 beds. And, this is a type of decision making that we've never had to in our lives prepared ourselves for, or really been prepared for, because we have lived in a country where our resources have always generally been plentiful, and we've never been in a situation like this. But to hear him kind of break as he talks about this is why we want to try to keep hospitals, with the sick patients. We want people to get checked out, but there's definitely something to be said for good at-home personalized care that doesn't require you to be in the hospital, and you could have great outcomes.
So physician-based or guided information from those that have been on the front line of the COVID-19 pandemic since the beginning. We've seen it. We've seen everything from the mild to the most critical cases. And the information is there. Of course, everybody recommending the social distancing, the masks, the hand sanitizers, hand washing, being smart about where you go. As I mentioned recently on a radio show, that when you walk into a business, you're going to know how seriously they take COVID based on how they're treating the staff and the situation, and making sure that you do those safety things, those preventive things to lower that potential spread and contact with the COVID-19 virus, but also learning and educating yourself on what you need to do, what you need to watch for, how do you care for your family members, and how do you, when you're in a home situation, you have one person with it, how do you protect others and to manage that situation that is already complicated with our home situations with COVID-19 anyway. What I searched for on Google is COVID-19 at Home Learning Agency, and every way that I did that with the @ spelled out, or the @ symbol, puts the Learning Center on the front page of information. It's called the Learning Agency Lab. You click on there, and that will get you to this information. And of course, as I mentioned, we will make this information available, the link to the site available on the description of the show as well. So, Jose, how can folks get in touch with you if they have more questions, suggestions, thoughts, or whatnot with regard to this program? And once again, I appreciate you bringing it to our attention, and of course, do love getting to see you other than our biannual meetings that we have for the Communications Committee.
My social media is @TerradasMD. Easy way. You can always follow me there. My biggest focus is on public health and education. I feel that being able to give as much information as we can to the non-medical public is the best thing we can do as a community to share our knowledge base, because we learn so much in school and we spend so much time with other doctors that we sometimes forget what we see on a day-to-day basis versus what I think non-medical folks might see or live on a day-to-day basis. So being able to bridge those two groups through education and high-yield learning is my passion. So I'm always on trying to find ways to connect with others.
Dr. Jose Terradas, incredible, great information, great work, and kind of at the soul of being a physician, being the one that wants to bridge that information gap that exists. The information that we learn through school and through practice and experience is not proprietary by any stretch of the imagination. And so much of healthcare is more than a pill or a treatment or an x-ray or a lab. It's really information, education, and guidance on terms of how to manage those things. And I think that's one of the things that in modern healthcare, with the drive for efficiency and throughput and all of that stuff, we've lost a lot of that ability to connect and communicate. So I look forward to all those efforts and appreciate it not only for all Americans and those around the world. And of course, we've seen you pop up in all kinds of places over the COVID-19 crisis and pandemic, and appreciate that information and know that it's there to help our patients and our communities and everybody who's impacted by that or this virus right now, and other topics beyond that. So I appreciate it.
No worries. It's an absolute pleasure, Ryan. I have to say, we've known each other from the very beginnings of my time on the Public Relations Committee. You're always the most distinguished Kentuckian I think I've ever met. I can't admit I know many, but you definitely take the cake. So I appreciate the opportunity to reach your audience and to take a few minutes about it. I'll just plug one thing real quick about caring for somebody at home. If you do find out that there is somebody at home who did get sick, really just choose the youngest, the healthiest person in the house to be the point person, and then go to the guide and learn about how to be a caregiver. But don't throw the sickest, oldest, most comorbid person into the mix first, because not the right move.
Not in terms of this, and yeah, it's important information. And so many of the folks that I've talked to recently have been, worried about the children. The parents get COVID and they're worried about their children and potential exposure. And of course, as a parent, I've got a 10 and a 12-year-old, and we have huge concern about them. And we know that they, for one reason or the other, tend to tolerate this better than a lot. So being very aware of your potential risk factors and the risk factors of others in that household, and taking those potential steps, and whether it be monitoring, testing, whatever it may be, to decrease that potential risk and to take care of each other. So that's why I think, mainly one of the main reasons to get onto this site beforehand. So, it's not, oh crap, we've got a positive test, now trying to catch up to the train that's already left the station. It's being ahead, it's being ready, assuming that at some point with families and the timing as this move forward, that somebody nearby, close by, related is going to end up with COVID-19, if not multiple folks, and being ready to help manage that, because in the old sayings of growing up TV, knowledge is power, and the most important thing right now is we want to make sure that you have the right knowledge and the right information. This right now, the COVID-19 and what we're trying to accomplish with home management and dealing with it from a household. It's not politics. It's not. It's nothing. It's nothing other than health, public safety, and what we deal with and have seen and learned from an emergency medicine, acute care standpoint with COVID-19. So, Jose, I really appreciate it as always. Wonderful friend, communicator, emergency physician, and I really appreciate the time. And as for me, you can contact me, youreverydaymedicine@gmail.com. That's youreverydaymedicine@gmail.com, or @everydaymed on Twitter. And until next time, I'm Dr. Ryan Stanton, and this has been CEMESA Frontline.